Read Democrat. They're led by Max Baucus. Joining us now to talk about where we're going with health care, and it's a healthy debate, of course, Democratic Congressman John Yarmuth and Republican Congressman Phil Rowe. So, Congressman Rowe, you have a very interesting story in that you were participated in TennCare, frankly didn't work out too well. What do you make about the public option that could be very expensive?
Well, what we learned in Tennessee was in 1993 and 94, we had a real problem with the uninsured, and we also had a problem with our Medicaid funding going up. So we created a public option called TennCare. We got a waiver from the HHS here in Washington and initiated TennCare, a managed care plan. We had about 8, I think, different plans at that time. Today, 15 years later, we have one. What happened to the cost? The problem was this. It offered a generous plan of benefits, and from 1993 until 2004, the spending of the state went up from about $2.6 billion on Medicaid or TennCare to over $8.5 billion, over tripled in costs. And the problem with the public option was it only paid about 60% of the cost of the provider. So you had a very rich benefit package that the consumer was happy with. But what happened was that it did not pay the cost of, let's say, going to the hospital or getting your lab work done or whatever. So that was a huge issue, and that's one of the things that we shifted. About 45% of the people who ultimately ended up on TennCare had private health insurance, dropped their private health insurance, and went on the public plan.
All right, Congressman Yarmuth, you are advising House Speaker Nancy Pelosi on health care. She just issued a statement, made some comments to reporters this morning, not long ago, saying that there is still going to be a public option in the House version, and that she says that this blue dog deal with the four of the 7 blue dogs is going to be preserved, and that does preserve the public option. So she's fairly confident. Are you confident as well?
Oh, I am. And, you know, I'm sorry Phil had so much problem in Tennessee. We have a very good situation in Kentucky, in my district and surrounding areas, with a public-private partnership that's reduced cost in Medicaid by $200 million a year. I mean, they're doing a great job. There are ways to do it. And the other thing it's important to realize that Medicare, which is, of course, the ultimate public option, has a cost growth pattern that's far lower than the private insurance sector. It's about 2.5 points lower. So government can do a good job of managing health care. And what our proposal is not to have government take over health care, but to compete with the private sector so that the competition of an entity with lower administrative costs and so forth can help bring prices down for everybody.
Representative Rowe, what do you make of the argument that government can properly run health care or Medicare is something like $44 trillion in the hole with unfunded liabilities? You don't hear the Democrats or the president talking about the unfunded liabilities of Medicare coming into this argument.
Well, it's a little more onerous than that. What you have is you have 2 public options, 2 public systems now, Medicaid and Medicare, neither of which pay the cost of the care. So those costs are shifted to private insurers, and what will happen is totally predictable what will happen. I can assure you these cost estimates are not anywhere close to what's going to happen. We saw this in Tennessee where we used managed care. We used everything we could, and as you shifted more and more people to the public option, you caused the cost shifting to private insurers to go up and up, and that's exactly what's happening in Medicare and in Medicaid and TennCare. Now, for my friend from Kentucky, a lot of Kentucky people, until we stopped it, came down to Tennessee because we had such a rich plan. When we initially had that option, all you had to have was a post office box. So we had a lot of people opening post office boxes in Tennessee.
You know, they didn't do it very efficiently. But I think the important thing to remember here is that we've got a lot of systems that we're trying to connect here. We've got the government system, Medicare, Medicaid, and the effects, the relationship between the private sector and the public sector are really inseparable. So these estimates that we get on cost are really not the whole picture, and we need to do something that's saving money across the system. We think that this competition can do that. And you know, CBO underestimated or overestimated the cost of the Medicare Part D prescription drug program by 35%. So these estimates and projections we're getting are always suspect.
Well, Congressman Yarmuth, though, I have to go. Go ahead, Congressman Rowe. Go ahead.
I agree with that. I agree that the estimates are suspect, and the problem is, I guess from our experience in Tennessee, is we're dealing with reality. We're looking. When I first came up here to Washington, I heard this public option, and I thought, well, we've already done that experiment in Tennessee. And that's our concern. Our concern also is if you shift enough costs to the private sector, you essentially put them out of business. And when you do, you end up with a single-payer system. Now, some people would think that's fine. There are a lot of people who want a government-run, bureaucratic single-payer system. I do not, and the reason is because I believe access and quality of care drop, and I think you see that in most of your public systems. For instance, in Britain and Canada, we can talk about that, and we plan to do that probably more as this debate goes on.
Well, Canada's the only system in the world that operates like it does. Nobody's talking about copying Canada in any event. We've got a situation that's unsustainable. We've got an insurance system that's dysfunctional, where insurance company profits have risen by 420% over the last decade, and the American people are losing insurance at the rate of $14,000 a day. We've got to do something to reform the entire system.
All right, Congressman, I want to ask this to both
agree.
of you. Let me ask you to both of you. Are you going to have a deal in the House before tomorrow? Tomorrow's Friday, guys. Are we going to have this done? What's going on?
Well, that's a process question. Energy and Commerce is going to report a bill out, but there's still 3 different versions that each of the committees, my Ways and Means Committee, Energy and Commerce, and Ed and Labor, we've got to meld all those into one bill, so that'll happen in September.
I like how these lovely
Correct.
gentlemen, their
I'm
first response was to laugh.
Yeah, right? Yeah. We appreciate the honesty, guys. We really do. All right. Congressman Rowe, Congressman Yarmuth, gentlemen, thanks for being with us. We appreciate it.
Thank you.
Thanks for having us.